tell you something most students don't hear enough. Reading alone is not enough. And passive review alone is not enough. And that is why you realize that at Cognito, we emphasize on solving as many question banks as possible. You need to train your mind to retrieve information and to be able to make split-second clinical decisions and to rule out distractors, under exam pressure. And that is a huge skill. It takes a lot of skills to be able to do that. And this can only come by doing questions again and again and again and again. So that when you take the MCQ one, you get to appreciate that this is not just a knowledge test, but rather a clinical-based decision-making test. And the more exposure you can get to, the exam style questions, the more your brain will learn to know how to stay calm on the exam, because that's also something we see coming up in a lot of our mock exams. Candidates try to rush through it and they are not able to spot key clues and think critically. So you don't want your first encounter with the MCC and the way they logically think through cases to be the exam day. No, you want it to happen right now so that, on the exam day, you go like, oh, I'm familiar with the way the MCC does its thing. And so this is not a difficulty for me at all. Number 3, the third reason is that you also learn from your mistakes. You will learn from your mistakes that the things you are reading, am I reading the right stuff? Because this is 55 questions. And I was thinking if the questions have, A, B, C, D, E, every question will have just one right answer. So you have 55 questions. Each of them is an A, B, C, D, E. So in reality, if I multiply 55 by 5, about 275 concepts. So I'm going to use the correct answer as a learning rationale, and I'm going to use the wrong answers as well as learning rationales as well. So every wrong answer is an opportunity for me because the MCC understands this, and when they brought up these questions, they also added references and rationales. So when you miss a question, you are not just guessing. You are actually learning why your choice was wrong and why the correct answer was right. So the moment of, oh, I didn't consider that patient's creatinine was too high, for contrast imaging, that sticks even way deeper than anything you read from a PDF or a textbook, which is recommended by everybody. And mistakes in practice are what prevents mistakes on the real exam date. So don't be afraid to be wrong. Be afraid not to rather try. And the painful thing and the beautiful thing is that this trying comes at no cost to you. The only thing you need to do is just to get a quiet place and sit and say that I'm going to try these questions.